you for being here. Your authority is vast and your responsibility is great, and you're a gentleman of distinguished stature, so I appreciate you being here today. You have to give serious answers to hard questions, and I do indeed have some hard questions to submit to you. I'll be submitting the more interesting questions in writing for the record after the hearing. For legislative purpose, I have a specific line of questioning regarding imported seafood. Just what I'm going to be discussing with you. As a matter of background, according to my research and investigations, about 60 to 65% of seafood consumed in America is imported. And generally speaking, given the limited resources that you have at your avail, you're able to supervise the inspection of about 0.1% of imported seafood. Is that generally correct, sir?
Well, we said a little differently. First, and by our count, it's more than 65% of seafood.
Right. This is the Republican side, so I'm being conservative.
Okay. But much as I described on the drug side just a few minutes ago, it starts with a digital inspection. That is, we have information about these facilities.
And the shipper and the owner and the importer.
And as it comes in, we use artificial intelligence now to look at the characteristics of the shipment to pick out. So it's not just the small number you referred to out of overall. It's a high-risk part of the import that we're
Yes, and I appreciate that level of expertise and of course, the dynamics of illegal imports would include inspections beyond the biological and chemical realm. But according to a September 2017 GAO report titled Imported Seafood Safety, the FDA and USDA could strengthen efforts to prevent unsafe drug residues in imported seafood. A whistleblower has come forward indicating that a company called Choice Canning, an Indian shrimp exporter, has knowingly shipped antibiotic-contaminated shrimp to the United States. Despite this, FDA data shows that only 21 shrimp samples from this company have been tested since 2003. Just to put this in perspective, again, respectfully, sir, you have a massive job to do and limited resources. I respect that. I want to help. This company that I'm referencing, the Choice Canning Company, which is a known violator, imported 24 million pounds of shrimp to the United States last year alone. So basically, imported seafood is coming into our country, and the billions and billions of pounds, is very little of it is being actually inspected at the laboratory level for biological and chemical contaminants. And the reason we're not getting sick is because we cook the seafood. Basically, that's the reality. So I would like to ask you, if you had legislation from this body that gave you teeth in your enforcement, like the authority and the mechanisms to destroy shipments that had been found to be contaminated, would that power be helpful for FDA enforcement of imported seafood that violates American standards for biological and chemical contaminants?
You asked the question in a specific way that I'm reluctant to say just yes.
You can say just yes.
What I would say is, in the general direction you're going, I would say in general, including this arena, the industries have by and large fought our ability to do what you described. It's not just true in the area that you mentioned, but in general, I believe we would exercise our authorities responsibly and could more quickly take care. I mean, there is stuff which sits there for a long time, given all the things we have to do in order to stop.
Roger that. Well, my intention, and thank you, sir, I'm going to close by saying that my intention is to legislatively empower the FDA to have very aggressive responses to shipments of contaminated seafood that enter our country. Mr. Chairman, I yield.
Let me thank you for that. And I'm a South Carolinian. I think our shrimp is better than yours. But in any case, there's nothing I'd like better than to see a resurgence of the seafood industry in the United States.
Well, I've learned from a young man not to argue with a gentleman in a bow tie, so I'll let you have that, sir.
Chair now recognizes Ms. Stainsbury from New Mexico for 5 minutes.
Thank you, Mr. Chairman, and thank you, Dr. Califf, for being here today. It's wonderful to have you. I want to thank your staff for being here today as well. And I'm grateful for the opportunity to highlight the importance of science and science-based decision-making in this hearing and all that you are doing to protect the American people, to ensure that we have access to medicines that work, that we have food that doesn't harm us, and to ensure that every American can get life-saving care. And also for your work in the administration's support of our work this last Congress to pass once-in-a-generation legislation to expand access to health care, to invest in science and innovation, and of course to expand access to prescription drugs for our seniors. The FDA is truly on the front lines of that battle every single day, and we're really grateful for the work that you do. And I'll say on a personal note, I have a family member who was formerly an FDA employee, and you represent the best of the best that our country has to offer. And nowhere is this more important than in the realm of reproductive care, where we have to continue to follow the science and ensure reproductive freedom, especially in the face of unprecedented attacks. You know, as we've seen, Republicans in this body, in fact, in this room and across the country, have been working to ban abortion, first through Donald Trump's Supreme Court, which overturned Roe versus Wade last summer, and then chipping away state by state to implement abortion bans, including where in Arizona just this week the courts upheld a Civil War era abortion ban. That's right, for folks that don't know this ban was put in place in 1864. Before an end to slavery had been ratified by this body, before women could vote, and before Arizona was even a state. Let's be clear. No judge, no politician, no person should be able to tell a woman, any woman in America or anywhere in the world, what she can do with her own body. And nowhere is this more important right now than in the United States Supreme Court, which we are all watching very carefully in the wake of their hearing of oral arguments in a case in which the FDA has been involved since the last couple of years over mifepristone. So Dr. Califf, I want to ask you a question. If you could talk to us a little bit, not only about the implications of the decision by the Supreme Court, which we're expecting this summer, for women to access reproductive care through medicated abortion, but also what are the wider implications for FDA's ability to use science to approve medicines?
Well, thank you for the question. I have to note that since this case is under consideration by the Supreme Court, I'm very limited in what I can say. I will say that we stand by our decisions. They're still in play today. And I'll add that, you know, we do have concerns if judges start second-guessing FDA decisions about what that means for the broader area of having a rational system of availability of medications and devices for the American public.
Right, so the FDA approved mifepristone to be used as a totally appropriate medicated way of addressing issues around reproductive care. And the broader implications are that if judges start legislating from the bench on this kind of medicine, it could be anything. It could be cancer treatments. It could be any kind of medication or intervention in your health. And I think the American people need to understand the implications of this case, the potential impacts for public health, and the ability for it to impact every American's opportunity to access life-saving care. So we appreciate your work. And I am personally thankful to be from a state, from New Mexico, that has worked to protect reproductive care. But if the Supreme Court does overturn FDA's decision to approve that medication this summer, we could see a ban on medicated abortion across the United States, including in places like New Mexico where it is protected. So that is why this body has to urgently take action. It's why we have to defend the science. It's why we have to sit here and defend our agencies who are making sure that American women and all people have access to the care that they need. And it's why we have to do everything we can to defend our institutions, because the lives of our communities literally depend on it.
Just a quick comment, if I may. Everywhere I go in the world, our system of drug development and decision-making is the envy of the rest of the world. They all want to be like us in that regard. As I've already commented, our use of generic drugs in public health is falling a little short now with our drop in life expectancy. But the system that you described is one that it's very important that we preserve in general, in addition to the topic you're specifically talking about.
Chair now recognizes Mr. Perry from Pennsylvania.
Thank you, Mr. Chairman. Thank you, Dr. Cahill. I want to talk to you about the World Health Organization and the...
I'm sorry, my name is called all kind of things. It's
Caliph, sorry, I'm sorry.
I've gotten a lot of different pronunciations here, but
That wasn't...
I'm used to that.
That wasn't an incorrect pronunciation. That was just plain damn wrong. But I want to talk to you about this treaty. I think 185, maybe plus nations, including places like Yemen, Iran, Iraq, Afghanistan, Cuba, Haiti, and some terms in that. We haven't seen it. We haven't seen the 30-plus amendments, so we're kind of shooting in the dark here, and I don't know that you know any more than any of the rest of it than we do, but there was another draft just last month that created a multilateral system for sharing pathogens with pandemic potential. I already listed some of the countries involved. It also commits each party, which would include us if we were signatories, to promote timely access to credible and evidence-based information on pandemics. And the aim there, I guess, is to combat misinformation and disinformation, I guess, as you see it or as they see it. So my question is, with the potential threat to U.S. sovereignty for decision-making on whether a pandemic even exists and the prescribed remedies, including lockdowns and maybe even medicating, would you commit before the committee today to pledge not to adopt policies included or pursuant to the treaty until such time, and if such time, as that treaty would be ratified by the United States Senate?
I'm not sure how to answer that question given the complexity of what you said, but it's hard for me to imagine that we would do something at FDA that's not a government policy. Now, you referred to the Senate in particular. I'm just not familiar enough.
Well, if the Senate doesn't ratify it, it wouldn't be a treaty that we would be signatories to, or at least not legally. And I just want to know if there's any intention on the FDA's part to institute any of the provisions within the treaty without the proper ratification from the United States Senate.
I don't think that particular issue would fall within our purview, and I don't know enough about it to make a commitment. I will comment that we, if we just look at the avian flu situation we're in now, the knowledge of the molecular structure of whatever the pathogen is turns out to be really, really critical to come up with countermeasures to treat it. And so I hope we can work out a way. And it also, even for food safety, we've talked about the imported food that we get. The genetic composition of the pathogen turns out to be really important. So I sure get what you're saying. We got to do this carefully, whatever we do. But I hope there will be a way that, for example, we don't get exposed to new pandemic where we know nothing about the organism until it's too
And
late.
we also, I think, most people in America want to maintain their medical sovereignty, the individual medical sovereignty that we all enjoy. Regarding censorship, the CDC was involved in media companies taking down social media posts regarding misinformation and disinformation, again, terms that I think are loosely defined, but involved. The FDA has been involved in this process in the past, having awarded several grants in the range of hundreds of thousands of dollars to places like the University of Maryland at College Park, Texas Women's University, regarding, again, misinformation and disinformation. Commissioner Califf, has the FDA coerced social media companies to take down users' social media posts regarding the pandemic or any other topic due to what they describe as mis- or disinformation? Not at all to your...
Not to my knowledge.
So would you consider, if you're paying, if the FDA is granting organizations like the University of Maryland or Texas Women's University to mitigate the spread of misinformation or disinformation, that's essentially subcontracting out that duty? You're saying the FDA hasn't done it particularly, but have they done it indirectly through their surrogates or their subcontractors via the grant program?
I'm not aware of the particular contract you're talking about, but let's remember that throughout the history of the FDA considers data and information, makes a decision about a product, puts together the risks and benefits into a judgment as to whether it should go on the market. It's put in the label. The label is then transmitted to clinicians all over the country who then work with their patients to make decisions about what to do. The sovereignty that you refer to is typically a patient-doctor relationship based on that information. Places like University of Maryland has a major first-rate medical center. They're intermediaries in this process of relaying useful information. Now, if someone is saying something that's flat out wrong, you know, how that's dealt with by University of Maryland, that's their business.
But it also has the imprimatur of your approval, and when they found out to have been wrong in the past for coercing social media companies to take down so-called posts that then were later found to be incorrectly done, where is the remedy? And is there an apology from the FDA? Is there an admonishment from the FDA to these universities that have been fast on the trigger and coerced and changed the narrative or changed behavior based on things that aren't true?
Far be it from me to apologize for a university. I'm a longtime university person before coming to FDA, but I think what the university does is the university's business.
Well, understand, it also is a reflection on the FDA. Mr. Chairman, I yield.
Gentleman yields back. Chair now recognizes Representative Brown from Ohio.
Thank you, Chairman, and thank you, Commissioner Califf, for coming before us today. On March 15th, 2023, Congresswoman Presley and I wrote to you urging an investigation into the link between chemical hair straighteners and uterine cancer. I would personally like to express my gratitude to the Food and Drug Administration for your rapid response and dedication to addressing this matter. I am pleased the FDA has already taken immediate steps with a proposed rule to limit the use of harmful chemicals found in many hair straightening products. As you know, Black women experience scrutiny and discrimination regarding our hair, which has led to widespread use of these products. Black hair should not restrict our ability to learn in school or advance in the workplace, nor should our hair care products come with health risks. As the FDA finalizes this rule, I look forward to working together to ensure our consumer products remain safe for everyone. Furthermore, I know you are hard at work to protect Americans in other ways, too. The Biden-Harris administration and Democrats continue to fight to protect and preserve women's reproductive rights. The FDA's recent landmark approval of over-the-counter birth control moves us one step closer to reproductive freedom, even amid brutal, backwards, and barbaric abortion bans like Arizona's and other attacks in reproductive health, including my own state of Ohio. Women must have the right to control when, if, and how to start a family. Increased access to safe and reliable contraception provides space for that decision to be made while putting control back in the hands of women. So, Commissioner Califf, what have been the impacts so far of over-the-counter birth control hitting shelves across America?
Well, we're in the early phase of it, obviously, and there's always a lot to work out when something goes commercially because of pricing and all. But the availability, I think, as more manufacturers come on the market, given the precedent, we should see much more wide-scale availability so that people can use the products as indicated.
Okay, thank you. And finally, one last issue I would like to touch on concerns a disease impacting far too many in the Black and brown community. Roughly 1 in 8 Black Americans live with diabetes, while in my district of Cuyahoga County, the Black diabetes rate is over 25%, over 1 in 4. Certain FDA-approved weight loss drugs aid in obesity management for adults with weight-related conditions like type 2 diabetes. For many, these drugs are life-changing and life-saving. Unfortunately, though, these medications are often too unaffordable and inaccessible for those who need them most, especially uninsured individuals. So, Commissioner Califf, how is the DA working to ensure these new, highly effective treatments are reaching populations who need them most?
Well, first of all, I appreciate your description of the problem, and there are special populations at much higher risk. You've referred to one. I'd say rural people in general are also suffering greatly, and it's one of the main reasons that we're seeing this very troublesome decline in life expectancy. Right now, despite the fact that we're producing the majority of the innovations in medical products, we're almost in last place among high-income countries in terms of life expectancy and the disability and multiple chronic diseases that go along with it. Unfortunately, our tools at FDA specifically are very limited for what you described because we are limited by law in dealing with price of products when they come to market.